Denmark is 200 times bigger than the United States. Currently in Denmark, Danes, people of Denmark, get free or heavily subsidized healthcare, education, and job training and compensation when they're unemployed, out of work, sick, or on a parental leave. That's from pbs.org. Where does all this funding come from? An increase in taxes. Americans would need to pay more taxes, and that tax burden, unfortunately, would fall predominantly on the middle class. NewYorkTimes.com. Today, the U.S. healthcare exceeds $2.7 trillion and consumes over 17% of the gross domestic product, which leaves, unfortunately, many U.S. citizens without insurance or access to healthcare. Data collected in 2009 show that Denmark's healthcare cost per person, public and private, was $3,512 for the year, where the U.S. is double that at $7,290 from the DevonPost.com. Electronic medical records, also known as EMR, and electronic health records, also known as EHR, are one thing that Denmark and the United States share. However, at this point, Denmark is 100% compliant with their primary care physicians and EMRs, whereas currently the United States is at 46%. That's from commonwealthfund.org. Danish patients have the ability to access all of their medical information, including medical records, test results, hospital discharge instructions. They can also make future appointments and cancel appointments as well. That's from commonwealthfund.org. Whereas currently now in the United States, we typically know it as MyChart. We can see our test results, future appointments, but we are not able to edit them as a patient. Also, EHR incentive payment programs are under reimbursement for care provided to Medicare patients, including physicians, dentists, optometrists, podiatrists, chiropractors, and hospitals. That's on page 232 of our textbook. The most common similarities between Denmark and the United States is when it comes to their elderly and long-term care. As our aging population continues to grow, resources are needed to accommodate the needs. Age, diagnosis, and the ability to perform self-care is when we turn to elderly care or long-term care. Page 349 of our text. Throughout the textbook, Healthcare in the USA, it notes different types of elderly and long-term care services such as skilled nursing facilities, assisted living facilities, home care, hospice, and adult daycare. In comparison to Denmark, has developed a wide range of services for the elderly, also including in-home or home care, along with adult daycare centers, adult day nursing centers, and sheltered housing. ncbi.hlm.gov. In conclusion, I hope that you have learned that the United States and Denmark are very different when it comes to cost and how they can pay for their health care, but we do need to take into consideration the size. However, I think as far as the United States, it is something that we should be able to improve on in the future. Secondly, most similarly is our electronic health records, but still we lag behind. And 100% the most common thing that we share with Denmark is our elderly care and services that we provide for our elderly.